But to this, the Health Department is urging people to continue following precautionary measures as the number of infections continues to surge. This is to curb the spread of the virus and to ease the burden on the healthcare system. To discuss this further, I'm joined by Dr. Ridwan Suleiman, Senior Researcher at CSIR. Dr. Suleiman, thank you so much for your time. Let's talk about these updated numbers in as far as daily cases. I spoke to the MMC of Health in Tshwane, making mention that just last year in December, they'd been recording, in their hundreds in terms of, confirmed positive cases and less than 10 in terms of death. But now, that number has doubled, almost, has actually increased 7 times over at least, with, over 1,000 positive cases and seeing those death numbers in their hundreds. What do you see nationally?
Good morning, Tumelo. Indeed, we do see that the number of cases are increasing nationally, driven mostly by a surge in the populous provinces in KwaZulu-Natal and Gauteng, and still high numbers in the Western Cape. We have recorded a record number of daily cases this week. If we look at the 7-day average at the moment, it's currently 16,200 new cases per day, and that's an increase of 28% compared to this time last week.
And just with that being said, is the Western Cape, Eastern Cape, Gauteng and KZN still the hotspot provinces? Are we still seeing other provinces also almost, becoming hotspots as well?
Well, there's a lot to talk about when we look at the individual provinces. I think let's start with the good news. We can be cautiously optimistic that there are early indications that the Western Cape is sort of reaching a peak in confirmed cases. If we look at the 7-day average, it's down 1% as compared to a week ago. I do say cautious, though, because the test positivity rate, or the number of tests per confirmed case, is still worryingly high at around 40%, but there is a glimmer of hope. The Eastern Cape has shown a sustained decrease for quite a while now. The concern is the rapid increase in KwaZulu-Natal and Gauteng. KwaZulu-Natal, the incidence risk has surpassed that of the Western Cape, and it is now the epicenter of the virus in the country. Cases in Gauteng are increasing or doubling every 14 days, showing an increase of almost 40% compared to a week ago. Now, all the other 5 provinces are also starting to show increases, and rapid increases too. If we look at Limpopo and Mpumalanga, they've shown an increase of 100% compared to a week ago, or doubling every 7 days. And Northern Cape, Northwest, and the Free State are doubling every 8 to 8.5 days.
Doc, let's talk about hospitals now then, with that being said. In terms of just the admissions we're seeing weekly, how is South Africa faring in their hospitals?
So the number of new hospital admissions is still on the increase. The new admissions for the last week are 10,600, and an increase of about 5,000 compared to the week prior. The number of new admissions in the big provinces, Eastern Cape, Western Cape, KwaZulu-Natal and Gauteng, all surpassed the levels that they saw at the peak of their first waves. The good news is that there is a decrease in new admissions in Eastern Cape following a decrease that they saw in cases. But the rise in Gauteng is quite noticeable. And also all of the other 5 provinces are also now showing increases in new hospital admissions too.
I think another number that we can't ignore is the number of deaths that we're seeing daily. Definitely that number has gone up. We're seeing 200s, 400s, 300s in their numbers losing their lives. In terms of the deaths in South Africa daily, how many are we recording, and overall, where are we so far?
Yes, the number of new deaths being recorded daily is increasing. At the moment, if you look at a 7-day average, we're looking at 477 new deaths per day. We need to bear in mind that there was a big increase in reported deaths a couple days ago in the Eastern Cape, and this was a backlog of deaths that occurred between May and November in 2020. So if we exclude those, the current 7-day average of deaths is 413 per day, which is still high and still an increase of almost 20% compared to a week ago. These numbers nationally are mostly being driven by high number of reported deaths in the Eastern Cape, the Western Cape, both recording about 140 new deaths per day. For the Western Cape, that's almost 3 times as high as what was recorded at the peak of its first wave. The number of deaths in KwaZulu-Natal is also increasing, about 16% up compared to a week ago, or doubling every 8 days. And in Gauteng, it's 68% up compared to a week ago, or doubling every 9 days. So those are quite high number of deaths being recorded every day.
All right, thank you for this update, Dr. Ridwan Suleiman, Senior Researcher at CSIR. Now,